Welcome to the next episode of What About My Practice, where we discuss the various aspects that affect us in our private dental clinics. In this episode 3 in our series, where we look specifically at the impact coronavirus has had on our practices, we discuss how to define an emergency treatment and the role telemedicine has to play. Remember to like our Facebook page and our Instagram page to receive up-to-date information about this series and the other programs brought to you by the Implant and Aesthetic Academy and the Bridge program. Morning, Corne.
Morning,
nice to
John.
see you again.
Yes.
I believe you've seen your first emergency patient recently, so I'd love to chat to you about how that went, and then also I think for today's video we can basically look at what are the process that you follow to actually get to that point. Following the questions that you ask the patient, how you triaged, how you set up the appointment, and then get to actually treat the patient. I think it's quite important that we kind of go through those, because that's probably the biggest questions that people are asking themselves. How do I get to the point to actually see a patient? So if we can go through that, that would be awesome.
Cool.
But hey, so how did it go?
It was a massive learning curve. Like I said in the previous video that I did, it was probably more of like a video diary entry just to help sort of process what happened and how we had to handle it. But yes, the patients both arrived luckily on time, exactly as we asked them to, and they waited in the car. And then we had a whole setup. It was like a very systemized process that we followed. I had my assistant there, my dental nurse, who's extremely good at setting up the proper sterilization protocols, and she got everything in the proper order for us to be able to see the patient. So she greeted the patient at the door and then took her in immediately into the surgery. So we didn't really have we didn't leave anything to chance. We wanted the patient to not touch anything. We didn't want them to bring their handbag or anything in. And then I did the procedure after setting up for we probably took about an hour or more just to set up the 2 rooms that I worked in. So it was quite a process. And then cleaning up afterwards was like maybe an hour and a half, 2 hours again. And we wanted to leave the space nice and clean for you guys, because I know that you're seeing patients on Friday. And most likely you'll see more than 2. So we want to make sure that the practice was at least nice and clean for you guys there.
Thanks. I'll do the same for you on Friday when I eventually get out of there. Seems like I'm going to be a busy boy on Friday afternoon already.
Yeah, I think you've already got a couple of people scheduled, eh?
Yeah, it's going to be fun, but it's great because we've got quite a few rooms. So I think what we're doing is basically hot jumping chairs. So we'll go from one room to the next and use all the rooms available, and then go back and clean all of them up afterwards. It's probably, we're lucky in that sense that we have multiple rooms to work with, but yeah, that's how we'll do it. Just to get back to that, I know that we kind of have a process where we have a central call center, and then from there we filter and triage the patients. Can you just run through what are the questions that you eventually did ask the patient when you got into contact with them, you informed that they were emergency? What is it that you actually followed?
So we're following the guidelines that we received from SADA and HPCSA, but the ADA actually put out quite a nice set of guidelines. I'm just going to share my screen with you quickly, and then we can look at that. It's a very nice, it's like a triage format that they have. So if we look at the screen here, so you can actually go onto the ADA's website, and they have all of these things available for anyone to look at. And basically, it's just how to ask patients questions about triage. It's quite a detailed list of questions, and then also to decide what is an emergency and what is not. So I just followed this protocol, but I mean, it's also just a bit of common sense. So I asked the patient what happened, obviously, and when did it happen, and how much pain they are in, and then we just talked through some practical points. Are they able to manage the pain at home? Um, have they been taking painkillers? The one patient specifically, which I think would be a classic emergency for all of us, was she had a cavity in her tooth, which she knew she was neglectful in not attending to before the lockdown. But I mean, we're not going to blame people for that now. That's not the time for it. And she was taking Miprodol or Genpain or something for 4 days already. And I obviously, after asking her a few questions, I decided that she probably needs an extraction or an emergency root canal treatment. So we just go through the guidelines we have. But also, I mean, it's the same type of questions that you would ask when you have an emergency patient phoning you over a weekend. So it's not much different to that. We also just add on to that some questions about exposure to the virus. Are they healthy? Medical history. And I think at the moment we don't really have a lot of people that have had contact with anyone with the virus. I haven't really had anyone giving me any sort of clear indication that they've traveled where the virus was. So, but we are probably going to see that in due course now.
Yeah, which is obviously a very interesting question to ask, because once you at the top of the list of triaging is, have you traveled, which I think is pretty irrelevant right now. And then have you actually been diagnosed, or are you experiencing flu-like symptoms? I mean, what do we actually do with those patients? The guys that are positive, that are high risk, what is the current guidelines as to what to do with them?
Yeah, so the only way of knowing is by following guidelines that's been sent to us. And again, I'll bring you to what we've received from the HPCSA and from SADA. So basically, this document tells us that we are supposed to, if we have patients that are positive, we're supposed to send them to the treatment centers that have been set out. And in the Western Cape, that is Tygerberg Hospital. So if you are speaking to a patient that is that has a dental emergency, that's the way to go.
Okay, so basically at this stage, we're referring all positive patients or patients with flu-like symptoms, we're going to have to refer through to Tygerberg. That is the answer at the moment.
That is the
in the
answer
Western
at the
Cape,
moment.
that is. Or you have to go look for your closest center, which is available on the is it Infectious Disease National Institute for Communicable Disease, NICD?
Yeah, the NICD. Yeah, the NICD has available on their website the centers that they've identified. But for us, the only one that we have is Tygerberg Hospital. As far as I know, that's where we're supposed to send anyone.
Okay. I know that we currently looking at some clinicians are trying to set up a qualified center that can treat positive patients. They're not there yet. What we'd like to do probably in future casts is to have a chat with some of those guys and to actually go through the protocol that they're following and what they're doing. And then hopefully we can give some more guidance, especially just in our area, for instance. But then obviously other people can have a look at what is available or what they can do in other centers around the country and around Africa.
Yeah, that's right. Yeah, I think it's important to know. Yes. Are you supposed to wake up?
I'm supposed to wake up. Just on when we're filtering those patients, what's regarding telephone conversations, teledentistry? In other words, if we allowed to give scripts over the phone, how does that work?
Yeah, so I'm gonna open the document from the HPCSA where they are very clear on what we are allowed to do there. They put out a notice on telehealth. I also know that this was something that was discussed very recently, I think 2 days ago, by DPL and MPL. They had a webinar where they discussed scripts that are sent over the phone and where we are able to see patients for virtual consults. And this is a really interesting topic because at the moment, the guidelines are saying that we are not allowed to charge for any of these consultations as a dentist. There's absolutely no guidance that we have on charging as a dentist. The medical professionals have more guidelines because I think it's more appropriate for them to have virtual consults. And then the second thing that they're clear about is that we are not allowed to give scripts to patients that are not currently our patients, so no new patients. And so scripts over the phone to new patients.
Yeah.
And also no charging or no billing for the advice to any new patients.
Okay, so just review that. So what you're basically saying is what the HPCSA is saying is that we can consult over the phone.
Yeah.
We're not allowed to give scripts to patients that are not registered with us.
That's right.
And we're not allowed to charge them.
Yeah, that is what I understand.
Is that what it means?
Yeah, that's what I understand from their documents, and what I also understood from what they said in that that webinar that the DPL had.
DPL.
So basically, it boils down to the fact that we're not covered. DPL doesn't cover us if we give a script over the phone without consulting with the patient.
Without consulting with a patient,
the sense in person.
If they're not our patient, or
That's
if
right.
they're any patient.
So
DPL does not cover you if you consult with a patient that is not a registered patient with you.
Yeah, if you give a script to a patient that is not a registered patient with you over the phone.
Okay, so it's not covered. Okay, cool.
Yeah.
That's following the current guidelines. I do know that the Medical Association is busy fighting that because obviously this is something new where in the past medical professionals were allowed to actually script over the phone if they follow the right protocol.
Yeah.
So this has been changed for COVID. So I know they are busy fighting that, but up until today, which is what, the 2nd of May, 2nd of April, those are the rules. So just stick to the rules and you'll be covered. Yeah.
Yeah. This is an interesting talking point because if we just go back to what we said right in the beginning, Jean, we said that we're screening patients and we're following the guidelines of other countries, which are first world countries and which have centers that are already set up to provide care for patients that are positive with the correct PPE. And we don't have that yet. And as a third world country and the whole of Africa, what are we going to do if we can't even give a script over the phone? So if we try and do the AAA, which is advice, analgesics, and antibiotics, we actually can't follow the AAA properly because we're not allowed to give a script over the phone if it's not your patient. And this is something that I think there's a big need for some clarity from our associations and from the HPCSA as to what we are able to do.
No, completely, I agree. I mean, that is your first line of defense if you can't go and help somebody that has an abscess. I mean, that is what you need to do. And if I'm limited to only my own patients, what happens to the guy that hasn't got a dentist or that hasn't got whose dentist isn't on call? There's so many people that are going to fall through the cracks. What am I going to do? Just send them to Tygerberg? It's not logical. But we are not the powers to be. We can only filter through these problems. We can only hope that they can figure it out. Then we leave it to the Medical Association, which is a very big body. Let them fight the battle. And let's hope that we get some clarity over the next few days.
Yeah, I think I'm really hoping for that because we definitely can't do it in the way that they're proposing at the moment.
No, exactly. Okay, so thanks very much, Corne. It's been an interesting talk. I think we did cover a couple of nice, interesting topics. The whole thing about telescripting is obviously contentious, and we'll see if we can get through that. But important that we just follow logical guidelines when it comes to filtering patients, and that we actually do, when we consult with people, we do it in the correct way, and we look at their best interest. I think what we can do probably in the next section is to look at PPEs and how we actually filter through that, and maybe we can organize a conversation with somebody that's built a nice little clinic like that. Yeah.
Perfect. Cool. Thanks for the chat.
Cool. Chat to you soon.